Okay po. Good morning po everyone. Doc, rinig po ba ako? Medyo nagloloko kasi yung internet.
Okay,
Audible
Doc.
naman.
Audible. Wala pa yung ano mo, yung PowerPoint.
Yes po, hindi pa po ako nakashare. Sige,
Okay,
sharing
okay.
my screen now po. Sorry. So good morning po everyone. Today we'll try something different. Hindi na po tayo magko-conventional lecture for today, pero we'll try a Q&A for our virology session. So I hope everyone po will try to answer on their own and try to see po kung ilan yung makukuha natin dito sa lecture na to. So we'll start po with basic questions. So question number one. So the following statements describe viruses except A. Viruses cannot grow on inanimate media, contain RNA or DNA. C. They are metabolically inert. And D. They can undergo mutation. So I repeat po. The following statements describe viruses except viruses cannot grow on inanimate media. They contain RNA or DNA. They are metabolically inert. And D, viruses can undergo mutation. So yan po. Very simple question. The answer here is, ano po tayo? Letter B. Tama. So viruses can only contain one genetic material as opposed to other microorganisms compared to our bacteria and etc. They can contain both DNA and RNA. Viruses themselves, uh, they don't have metabolic activities on their own and they rely on hijacking host defenses para makapag-produce sila ng mga components nila. Okay, so next question number two. Which of the following viruses exhibit a complex capsid symmetry? So A. Tobacco mosaic virus, B. rhabdovirus, C. paramyxovirus, or D. pox virus. Now I repeat, which of the following viruses exhibit a complex capsid symmetry? So A. Tobacco mosaic virus, B. rhabdovirus, C. paramyxovirus, or D. pox virus. Yan po. So the answer here is letter D, pox virus. So the capsid, that is the protein shell that encloses yung nucleic acid genome natin. And the capsid plus the nucleic acid genome, this comprise the nucleocapsid, and this is the infective unit of the viral cell. This is otherwise known as the virion. So pox virus, this contains two shapes, kaya tinawag natin siyang complex. Kaya naging complex yung kanyang capsid symmetry. So at the head, ang kanyang shape would be icosahedral in symmetry. So parang polygon shape siya. Tapos doon sa tail niya, nagiging helical siya, kaya naging complex. Rhabdovirus, nandito, rhabdovirus, these are bullet shape. And yung other choice naman natin is helical, yung kanilang capsid symmetry. Okay, so next question number three. The following statements regarding the viral envelope is true except A. The viral envelope is derived from the host cell cytoplasm. B. Envelopes confer chemical, antigenic, and biologic properties for viruses. Letter C. Budding and subsequent acquisition of the viral envelope will always lead to host cell death. And D. Proteins associated with the lipid bilayer of the envelope is host-derived. So, ulitin po natin. The following statements regarding the viral envelope is true except letter A, the viral envelope is derived from the host cell cytoplasm. Letter B, envelopes confer chemical, antigenic, and biological properties for viruses. Letter C, budding and subsequent acquisition of the viral envelope will always lead to host cell death. And D, proteins associated with the lipid bilayer, the envelope is host-derived. Hindi ko na-edit. The answer here is letter A. Please disregard yung PowerPoint. This is letter A dapat. So, the viral envelope is derived from the host cell's plasma membrane, not the cytoplasm. Tapos, in terms of viral release, budding may or may not cause host cell death. For non-envelope viruses, ang ginagawa nilang type of release would be cell lysis. So, yun yung laging magkakos ng host cell death. So, budding it will only cause host cell death or apoptosis kapag overwhelming na yung numbers niya or kapag super dami na ng mga virus na nare-release. So letter A po. I hope nakuha naman. So, question number 4. Which of the following RNA viruses is double-stranded? So number 4, ulitin po natin. Which of the following RNA viruses is double-stranded? So A. Caliciviridae, B. Paramyxoviridae, C. Coronaviridae, or D. Birnaviridae. So RNA viruses, they are usually single-stranded lang and they are classified as positive sense or negative sense RNA viruses. That's related to the transcription of their mRNA. However, for this case, meron lang tayong iisang RNA virus na merong dalawang strands. And that is Birnaviridae. Base na lang natin dun sa name niya, biRNA, which signifies two segments of RNA strands. So Calici and coronaviruses, they are positive sense RNA viruses. And Paramyxoviridae, they are negative sense. So number 5, which of the following is the largest animal virus? Number 5, which of the following is the largest animal virus? So A, we have Paxviridae, B, Cercoviridae, C, Picornaviridae, or D, none of the above. I repeat, which of the following is the largest animal virus? So A, Paxviridae, B, Cercoviridae, C, Picornaviridae, or D, none of the above. Medyo basic pa siya, no? Ang dami pa rin nakakakuha talaga, which is very nice. The answer is letter A, Paxviridae. Siya yung largest animal virus and it has a diameter of 400 nanometers. Yung other choices doon, they are smallest viruses in several categories. So Cercoviridae is the smallest animal virus. Picorna and Astroviridae, these are the smallest RNA viruses. Okay. Question number 6. These viruses are transmitted and replicate in arthropod vectors. Number 6. These are viruses that are transmitted and replicate in arthropod vectors. So A. Papillomaviruses, B. Orthomyxoviruses, C. Arboviruses, or D. Arenaviruses. The answer po here would be letter C. Arboviruses. They are also known as arthropod-borne vectors. So based dun sa name po ulit nila. Now in terms of double-stranded DNA viruses, there is a single member of the meron lang siyang isang arbovirus which is yung African swine fever natin. So African swine fever, I repeat, is the only double-stranded DNA virus that is also considered as a arbovirus. So question number 7 po tayo. What viral disease exhibits a zebra stripe pattern of the colonic mucosa at postmortem? So what viral disease exhibits a zebra stripe pattern of the colonic mucosa at postmortem? So is it Jones disease? Is it cattle plague? Parvoviral enteritis? Or porcine proliferative enteritis? So what viral disease exhibits a zebra stripe pattern of the colonic mucosa at postmortem? Ayan. So the answer po here is letter B. Cattle plague, also known as rinderpest. Although dun sa ibang choices natin, such as dun sa Jones disease and dun sa letter D, porcine proliferative enteritis, we can observe thickening din of the colonic mucosa. However, the question asks for viral disease which causes this. In cases of parvoviral enteritis naman, usually ang makakikita natin doon would be denudation and thickening of the intestinal loops, not the colonic mucosa. So the cause of rinderpest is a paramyxovirus and this led to the establishment of veterinary medicine in the Philippines. This disease has since then been eradicated. So question number 8, where does canine distemper virus replicate after infecting a susceptible animal? So where does canine distemper virus replicate after infecting a susceptible animal? So A, oropharynx, B, nasopharynx, C, lymphatic tissues of the respiratory tract, or the oral mucosa. Ayan. So the answer here is letter C. So canine distemper virus initially replicates in the lymphatic tissues of the respiratory tract. Tapos nagkakaroon tayo ng viremia bago siya ma-disseminate to various systems of the body kung saan nagkakos na siya ng clinical signs. Although hindi naman always or sa lahat ng cases may makikita tayong nervous, respiratory, or GI systems. And this is a fairly common disease. I'm sure you have encountered this. So nervous system signs, once they have manifested, hindi na siya mawawala. Ayun. So more on that disease, this is also known as hard pad or Carr's disease. Carr's disease. Next, question 9. This is about Newcastle. So this form of Newcastle disease is characterized by mild or subclinical respiratory infection. So this form of Newcastle disease is characterized by mild or subclinical respiratory infection. Is it Doyle's form? Is it Beech's form? Is it Bidet's form or Hitchner's form? The answer here is letter D. Ayan. So Doyle's form, this is also known as viscerotropic velogenic form. And the first clinical sign that we will observe here is, or it's not even a clinical sign, no? Pero according to several references, it is the number of, or a huge number of dead birds na makikita na lang natin after roosting. Namatay na lang sila. So neurotropic velogenic or Beech's form, this also has high mortality. Tapos clinical sign na ma-observe natin dito would be respiratory and nervous signs. Nagkakaroon tayo ng pneumoencephalitis. With that form or mesogenic isolates ng ating NCD, mortality rate is medyo moderate, let's say around 50%. This causes respiratory signs. And nervous signs, however, mas mababa lang talaga yung mortality as compared to the previous forms. Lentogenic isolates or Hitchner's form, mild respiratory disease lang siya. And we have also asymptomatic forms, although rare. Hindi naman siya masyadong nagpapakita. Next, question number 10. The following statements regarding rabies are true except A, the virus may be transmitted via aerosol. Letter B, this utilizes acetylcholine as a receptor for attachment. Letter C, this produces furious form of the disease once it reaches the limbic system, or D, none of the above. Okay, once more. Which of the following statements regarding rabies is false? So, yun, reword natin. So, the virus may be transmitted via aerosol, utilizes acetylcholine as a receptor for attachment. C, this produces the furious form of the disease once it reaches the limbic system, or D, none of the above. So, answer here is letter D. Wala pong false dyan. Rabies may be transmitted via aerosol in special cases. For example po dun sa mga bat caves natin kung saan medyo mataas na yung concentration of the virus, doon lang siya natatransmit via aerosol. And this serves as an important reservoir or natural reservoir of the virus dun sa environment natin. So bat caves. Question number 11. So what happens to a 70-day-old fetus after infection with porcine parvovirus? So what happens to a 70-day-old fetus after infection with porcine parvovirus? A, the fetus is resorbed. B, the fetus fails to mount an immune response and dies. C, the fetus will mount an immune response. Or D, none of the above. Ayan. So porcine parvovirus, the most obvious clinical sign dito would be return to estrus sa mga baboy, no? Pero if pregnant animals yung na-affect dito, it depends kung nasa ang stage na ng fetus or nasa stage of development yung fetus natin. Doon mo ma-observe yung clinical signs. So if the fetus is infected at less than 30 days of gestation, nagkakaroon tayo ng resorption. 30 to 70 days may or may not die. Or pwede rin tayong magkaroon ng mummified fetuses. 70-day onwards, nagkakaroon na ng development of immune response since at days 50, I think 50 to 55 days of gestation, doon na nag-i-start yung development ng immunocompetence ng mga fetus natin. Ayan. Letters. Question number 12. Which of the following is not seen in cases of feline panleukopenia? So which of the following is not seen in cases of feline panleukopenia? So letter A is MEDI, B, thickened and hyperemic bowel loops, C, cerebellar hypoplasia, or D, all are possible findings. Ayan. So the answer here po would be, tignan natin yung chat. Tama po, the answer is letter D. All are possible findings in cases of feline panleukopenia virus infection. So SMEDI may be exhibited by pregnant queens. Tapos, in very rare cases, nagkakaroon tayo ng destruction of germinal epithelium during perinatal period, and doon na tayo nagkakaroon ng cerebellar hypoplasia. And if kittens are born with cerebellar hypoplasia, magkakaroon ng cerebellar ataxia. Then ang inborn na clinical signs nun, magkaka-tremors yung animals, magkakaroon ng imbalance, magkakaroon ng ataxia, etc. Pero very rare na siya since majority of pregnant queens nagkakaroon ng minor degree of resistance doon sa virus. So hindi naman nagkakaroon usually ng cerebellar hypoplasia. Question number 13. What is the tissue tropism of orthomyxoviruses? So number 13, what is the tissue tropism of orthomyxoviruses? So A, intestinal crypt epithelium, B, respiratory epithelial cells, C, tonsillar epithelium, or D, peripheral nerves. So what is the tissue tropism of orthomyxoviruses? The answer here is letter B, respiratory epithelial cells. So yun po, please remember na yung tissue tropism ng ating microorganisms will usually indicate kung anong type of disease yung ipoproduce nila. So orthomyxoviruses, they produce respiratory disease in animals. Tapos they exhibit a very high rate of mutation. So importance na, or pinaka-important species of orthomyxoviruses would be influenza virus. Ayan. So other choices natin, intestinal crypt epithelium, mga microorganisms or viruses na may tropism dito would include your parvoviruses. Tapos, tonsillar epithelium, I think African swine fever virus. Then peripheral nerves, of course, rabies. Okay, sorry. Which of the following statements describe parvoviruses na reveal na? So, this is a single-stranded DNA virus, or B, canine 6 weeks to 6 months old are highly susceptible to the infection. C, they are fragile viruses and cannot persist without a host, or D, thymic atrophy may be seen in cases of CPV. The answer here is letter C. Pakita na kanina. Parvoviruses, they are very resistant. They're very resistant viruses. They can resist a wide range of disinfectants, and indoors kapag wala naman silang harmful na pinagdadaanan. For example, hindi sila mag-undergo ng desiccation or disinfection, they can remain infective for at least 2 months. Next, question number 15. So, gallid herpes virus 2 produces which disease? Gallid herpes virus 2 produces which disease from the following? Is it Marek's disease, Pacheco's disease, avian infectious laryngotracheitis, or duck plague? The answer here is letter A, Marek's disease. So the following yung ibang kinokos pa ng mga herpes viruses natin. So duck viral enteritis, this is caused by annatid herpes virus 1, infectious laryngotracheitis, gallid herpes virus 1, Pacheco's disease, cetacid herpes virus 1. So Marek's disease, this is a progressive disease in chickens or in poultry. Tapos lymphoma yung usually na makikita natin clinical sign, and paralysis of one or both legs. Upon necropsy, ang pinakamakikita nating lesion would be the enlargement of the sciatic nerve. Yeah. So question number 16. How do papillomaviruses escape host defenses? So, how do papillomaviruses escape host defenses? A, is it through accumulation of mutation? B, latency in basal epithelial cells. Letter C, by production of large amounts of soluble proteins, or via cell-to-cell fusion. Answer here would be letter B. So basal epithelial cells are also known as keratinocytes. And nandito sila dun sa pinaka-bottom dun sa picture, yung color brown dyan. So papilloma viruses, they stay here and they remain dormant. Kasi undifferentiated yung mga basal epithelial cells natin. However, once na naka-reach na sila dun sa surface ng epithelium, kakaroon na ng differentiation, then doon na nagiging infective ulit yung mga papilloma viruses natin. Okay, next, number 17. Which of the following viruses has the ability to cause cancer or tumors once it is introduced to transgenic animals? So which of the following viruses has the ability to cause cancer or tumors once it is introduced to transgenic animals? A. Pox viruses, B. Papillomavirus, C. ASFI virus, or D. Equine infectious anemia virus. First, let us define what are transgenic animals. So these are animals that receives a gene, a foreign gene, usually. So papillomavirus ang answer natin dito. And ang nangyayari dyan, nagpo-produce sila ng equine sarcoid. So this is associated with bovine papillomaviruses 1 and 2. These are the strains na mapupunta sa kabayo, then magkakasa ng equine sarcoid. Other sources, ang tawag nila for these papillomaviruses would be Delta papillomavirus 4. And equine sarcoid, it is the most common skin tumor occurring in horses and donkeys, if you consider them. Okay, number 18. Which of the following is the etiologic agent of Runting-Stunting syndrome? Which of the following is the etiologic agent of Runting-Stunting syndrome? Letter A. Avian leukosis virus, B. astrovirus 2, C. chicken anemia virus, or D. influenza A virus. Answer here is letter B. Ayan. So Runting-Stunting syndrome, nagkakaroon tayo ng degeneration sa villi. So nagkakaroon ng malabsorption, hindi lumalaki ng tama yung mga chicken. Never stunting. Okay, question 19. Which of the following is the etiologic agent of feline infectious peritonitis? 19. Which of the following is the etiologic agent of feline infectious peritonitis? So, D. Feline coronavirus. Yan po. So, ang nangyayari po dito, nagkakaroon ng mutation yung coronavirus natin na conventional. So, clinical signs usually na makikita natin for coronavirus is diarrhea lang and vomiting, of course. Then, after mutation, nagiging feline panleukopenia virus na siya. It may develop into two forms, a dry form and a wet or effusive form. Ayun po. And the test used to screen yung mga patients natin would be Revaltas test, and this involves yung coagulation. Coagulation ng discharge or ng mga exudates na makukuha doon sa body cavity. Ayan. This is very rare pala, and this develops only in less than 5% of the population ng felines infected with coronavirus. Okay, so next po, question number 20. The following etiologic agents are respiratory pathogens except letter A. Canine adenovirus 2, B. Bovine herpes virus 1, C. Feline herpes virus, or D. Pestivirus. The following etiologic agents are respiratory pathogens except A. Canine adenovirus 1, B. Bovine herpes virus 1, C. Feline herpes virus, or D. Pestivirus. Answer po dito is letter D. Pestivirus. Canine adenovirus 2, this is associated with our kennel cough. Tapos, bovine herpes virus 1, this is associated with shipping fever. Ayun. Feline herpes virus, this is associated naman with feline respiratory disease complex, and this produces similar clinical signs compared doon sa feline calicivirus na. And pestivirus, this belongs to the family Flaviviridae, and this causes hog cholera po, or classical swine fever. Ayun. Next po, question number 21. So this disease is characterized by darkening of the body surface of fishes as well as necrosis of the liver, spleen, and kidneys. So this disease is characterized by darkening of the body surface of fishes as well as necrosis of the liver, spleen, and kidneys. Letter A, epizootic hematopoietic necrosis, B, black spot disease, C, white spot disease, or carp disease. Answer po dito is letter A. B and C, these are caused by protozoal microorganisms. Tapos letter A, infectious hematopoietic necrosis or enzootic hematopoietic necrosis. This affects salmonid fishes. Tapos tinatarget nito yung mga hematopoietic organs nila. So question number 22. What is the main difference between transmissible gastroenteritis and porcine epidemic diarrhea? So what's the main epidemic diarrhea? So A, older pigs are more severely affected by PED as compared to TGE. B, younger pigs are more severely affected by PED as compared to TGE. C, older pigs are more severely affected by TGE as compared to PED. And D, younger pigs are more severely affected by TGE as compared to PED. Confusing po ba yung choices? Yan po. Usually kapag mayroong conflicting statements, 50% na lang po yung chance dyan na makuha natin. So let us just deduce kung ano yung mga choices dyan. So both are caused by the same family of viruses and they exhibit similar clinical signs. So makikita natin dito, watery diarrhea in pigs of all ages, minsan may vomiting. For PED, bihira po matamaan yung adults natin. Pero however, if natamaan sila, magiging mas severe yung clinical signs as compared to younger animals. Next, we have number 23. So upon necropsy, this disease has the characteristic turkey egg, kidney, and button ulcers. So upon necropsy, this disease has the characteristic turkey egg, kidney, and button ulcers. So A, FMD, B, hog cholera, C, African swine fever, or D, swine erysipelas. Dami pong nakakuha. Tama. Yes po, this is letter B, hog cholera. Ayan, this is a reportable disease to the OIE. Tapos nasabi na po natin kanina yung etiologic agent niya. And this serves as a differential diagnosis for our African swine fever along with swine erysipelas and PDNS or porcine sayang PDNS, nephropathy syndrome. Next, question number 24. The following diseases are transmitted by mosquitoes except A, Western equine encephalitis, B, Japanese bee encephalitis, C, West Nile virus, or D, looping ill virus. So the following diseases are transmitted by mosquitoes except Western equine encephalitis, Japanese bee encephalitis, West Nile virus, and D, looping ill virus. Answer po dito is letter D, looping ill virus. This is transmitted by ticks, namely Ixodes ricinus. And this is a disease po in sheep. Do take note that these diseases are also, yung mga encephalitis, they are zoonotic. Question number 25. Where is the primary site of replication of African swine fever virus? So where is the primary site of replication of African swine fever virus? So A, tonsils, B, colonic mucosa, C, lymphatic vessels, or D, nasal mucosa. Ayan. Answer po dito is letter A. So African swine fever virus primarily replicates in the tonsils and lymphatic nodes or lymph nodes of the head and neck. So according sa works to, 26 African swine fever virus po ulit. So the following statements regarding African swine fever is accurate except, so all are true except letter A. The primary route of infection for African swine fever is the upper respiratory tract. B, the virus is present in all secretions and excretions that contain blood. Letter C, it is a non-enveloped double-stranded DNA virus. And D, ornithodoros ticks are the biological vectors of the virus. Yan. The answer po dito is letter C. African swine fever virus is enveloped. And according po sa Merck's veterinary manual, important po ang respiratory route for the transmission of the disease. Next, which does not belong to the group? Papillomaviridae, Adenoviridae, Parvoviridae, or Hypadnaviridae. Which of the following do not belong to the group or does not belong to the group? Papillomaviridae, Adenoviridae, Parvoviridae, or Hypadnaviridae. Yeah, the answer po dito is letter D. Yan po. All the mentioned viral families, they are non-envelope and icosahedral. Ang main difference lang po, Hepatnaviridae is envelope. Yun lang po. Next, question number 28. Which of the following accurately describes the disease caused by burnovirus in chickens? So, which of the following accurately describes the disease caused by burnovirus in chickens? So, letter A, there is a development of mucopurulent nasal discharge with facial swelling. B, there is immunosuppression which predisposes the animal to secondary infections. Letter C, manifested by respiratory, neurological, and GI disease. And D, there is a decrease in the number and quality of eggs. Yan po. So the answer po dito is letter B. So burnovirus, this causes infectious bursal disease, especially sa mga young chickens natin. And ang main po na lesion natin dito would be an atrophy of the bursa of Fabricius. So bursa of Fabricius, that is an important storage area for our B lymphocytes. B lymphocytes, they are important for humoral immunity. So against bacterial infections siya. So kapag nagkaroon tayo ng atrophy doon sa area yon and nabawasan yung immune response ng animal, predisposed po sila sa secondary infections, then magkakaroon ng stunting, then death. Number 29, the etiologic agent for swine vesicular stomatitis belong to which viral family? The etiologic agent for swine vesicular stomatitis belong to which viral family? So A. Picornaviridae, B. Poxviridae, C. Rhabdoviridae, or D. Orthomyxoviridae. Ayan po. Answer po is letter C. Rhabdoviridae. So Picornaviridae ang kinukas po nilang disease, specifically yung aptovirus from the family Picorna is foot and mouth disease. So same po. It is a differential diagnosis for our swine vesicular stomatitis since nagpo-produce po sila ng vesicles. Ganon din yung Poxviridae. This may also serve as a differential diagnosis for that kasi nagkakaroon din po ng vesicle formation. Question number 30. Which of the following is the etiologic agent of avian influenza? Which of the following is the etiologic agent of avian influenza? Ayan po. Answer po dito is letter A, H5N1. Yung other choices po natin, ito yung mga kinakos nilang disease for swine flu or swine influenza. We have H1N1 and H3N2. For equine influenza, we have H7N7 or H3N8. Tapos for canine influenza naman, H3N8. Tapos implicated na nakuha nila from horses. Okay. Question number 31. Which of the following animal vesicular diseases strictly infect pigs? So which of the following animal vesicular diseases strictly infect pigs? Yan po. Answer po is letter D, nasa name na po. Swine vesicular disease. Ayan, so I listed po yung mga host ng ibang diseases po na in-include ko sa question. So FMD disinfects cattle, swine, guinea pigs, sa cloven hoof animals. Horses po seldomly affected pero meron. Vesicular stomatitis, cattle, swine, horses, and guinea pigs. Vesicular exanthema, we have swine and horses. Tapos swine vesicular disease, swine only. Usually, ang na-observe po natin initially na clinical signs from all of these diseases would be fever and magkakaroon ng lameness. Magkakaroon ng denudation doon sa hoof area. These are bovine papillomaviruses that appear on the head and on the neck. So question number 32. These are bovine papillomaviruses that appear on the head and on the neck. So bovine papillomavirus 1, B bovine papillomavirus 3, C bovine papillomavirus 4, or D bovine papillomavirus 5. Yan. The answer po dito is letter A po. Bovine papillomavirus 1, and include na din natin si bovine papillomavirus 2. They produce lesions on the head and neck region. So depending on the strain of our bovine papillomavirus, iba po yung area kung saan sila magpo-produce ng clinical signs. So for BPV3, cutaneous papillomas, and usually diffuse po ang distribution dito. Bovine papillomavirus 4, this produces malignant papilloma, and this is associated with the ingestion of Brackenfern. BPV5, this produces tick papilloma. And please remember, BPV1 and 2 are indicated as the etiologic agents of equine sarcoid. Question number 33. Which of the following events will occur if porcine fetuses have been inoculated with porcine circovirus 2 at around 50 days of gestation? So, which of the following events will occur if porcine fetuses have been inoculated with porcine circovirus 2 at around 50 days of gestation? So, letter A, mummification in fetuses. Letter B, fetuses will be stillborn. Letter C, fetuses will show no lesions. Or letter D, none of the above. So, the answer po dito is letter A. Yan po. So, this infection, yung PCV2 infection natin, porcine circovirus 2 infection, similar siya sa porcine parvovirus infections. So, mummification in fetuses will occur kapag yung inoculation natin occurs at around 50 to 70 days of gestation din. Tapos, ganoon din, 70 days above, pwede magkaroon ng, iba dito, sorry. Sa following fetuses inoculated 75 days of gestation, magkakaroon ng stillborn. Pero sa ano kanina sa porcine parvovirus, nakaka-develop na sila ng resistance at around 70 days, okay na sila. Ayun, fetuses inoculated at 92 days of gestation for porcine circovirus 2, walang lesions. So they will develop resistance. Also, please take note, ang strain natin na infective for porcine circovirus would be PCV2B. Ayun. Question number 34. The most severe infections of bird flu are caused by this influenza A strain. So the most severe infections of bird flu are caused by this influenza A strain. Letter A, H5N7, letter B, H1N1, C, H3N8, or D, none of the above. Yes po, the answer here is letter A. So H5N7, they are also known as highly pathogenic avian influenza strains. Okay, so question number 35. Based on antigenicity, how many subtypes of neuraminidase and hemagglutinin are recognized for influenza A? So based on antigenicity, how many subtypes of neuraminidase and hemagglutinin are recognized for influenza A? So letter A, 16HA and 9NA. Letter B, 10HA and 7NA. Letter C, 16HA and 7NA. And letter D, 9HA and 16NA. Yan po. Dalawa lang ang pagpipilian dyan. We can cross out letter B and C. So the answer po dito is letter A. So there are 16 subtypes of hemagglutinin and 9 subtypes of neuraminidase. So additional variations may occur within subtypes. So depende sa serotype, sa host, sa site of origin, etc. So yun yung mga ginagamit nila for new discoveries. Next po, number 36. Viruses from the family Paramyxoviridae replicate in which part of the cell? So viruses from the family Paramyxoviridae replicate in which part of the cell? Letter A, the nucleus, B, cytoplasm, C, plasma membrane, and D, ribosome. Ayan. So answer po is letter B. So replication of paramyxoviruses take place in the cytoplasm and they are released by budding. Tapos yung nucleocapsid nila, paki-take note na lang din, they have the characteristic herringbone appearance. Hindi ko na nakita yung picture sa mga references ko. Pero yun, herringbone appearance. Capsid symmetry nila. So number 37, in which animal species does FMD cause the most persistent infection? Number 37, in which animal species does FMD cause the most persistent infection? Letter A, cattle, B, sheep, C, swine, or D, none of the above. Answer po is letter A. So in cattle, infections with FMD virus may persist for 2 years. In sheep, 6 months. Pero sa pigs, wala po tayong persistence ng infection. Number 38. Which of the following viral diseases is not zoonotic? So which of the following viral diseases is not zoonotic? So letter A, Eastern equine encephalitis. B, foot and mouth disease. Letter C, cowpox, or D, foulpox. Alin po dyan ang hindi zoonotic? Yes po. The answer is letter D, foulpox. So Eastern equine encephalitis may cause meningitis in humans. Tapos cowpox may cause a disease known as Milker's nodules as shown dyan sa picture natin. Take note din po na cowpox, this led to the development of vaccines. Kaya yung pangalan niya vaccine kasi based dito, vaca. Ayun, foulpox, wala po tayong ma-observe na clinical signs sa tao. Ayan, so this disease is often confused with the diphtheritic form of foulpox. So this disease is often confused with the diphtheritic form of foulpox. Letter A, infectious laryngotracheitis. Letter B, fowl cholera. C, Newcastle disease, or D, candidiosis. The answer po dito is letter A, infectious laryngotracheitis. So foulpox po, we have two forms, and that is the cutaneous form or diphtheritic form. Cutaneous form, yan po yung mga usual na nakikita natin sa manok, yung mga multifocal lesions doon sa mukha nila na kulay black. Mga ganun po, nagmumukhang sores minsan, and those are usually transmitted by mosquitoes. Diphtheritic form, or otherwise known as the wet form, nagkakaroon po ng lesions around the mouth, the pharynx, the trachea. Ayun po, parang magkakaroon ng fibrosis minsan. And typical foulpox lesions, hindi po natin makikita for diphtheritic form in certain cases. So nagmumukha siyang tawag dito, infection lang ng upper respiratory tract. Next po, number 40. Completely dependent on their host for their machinery of energy production and synthesis of macromolecules. So letter A, viruses. B, bacteria. C, protozoa. Or letter D, prions. Expect po na makakita kayo ng mga ganitong questions sa board later, mga DOD na tinatawag or mga common sense lang. Meron at meron pong mga ganito. The answer here is viruses. Yan. So what is the infective unit of the virus? Is A, capsid, B, nucleus, C, nucleocapsid, or letter D, peplomers? What is the infective unit of the virus? Letter A, capsid, B, nucleus, C, nucleocapsid, or D, peplomers? The answer po is letter C, nucleocapsid, also known as virion. Na-mention na po natin ito earlier. Question number 42. So these are single acidophilic cytoplasmic inclusion bodies seen in tissue scrapings of foulpox. So these are single acidophilic cytoplasmic inclusion bodies seen in tissue scrapings of foulpox. A, Bollinger bodies, B, Borel bodies, C, Negri bodies, or D, none of the above. Dalawa lang po ang pagpipilian dito. It's either Bollinger or Borel bodies. The answer po is letter B, Borel bodies. So Borel bodies, those are single inclusions. However, kapag nag-form na sila ng aggregates, ang tawag na sa kanila would be Bollinger bodies. Number 43. In terms of disinfection, what happens when African swine fever is stored in an environment with serum? So in terms of disinfection, what happens when African swine fever is stored in an environment with serum? So letter A, African swine fever becomes more resistant. B, it becomes less resistant. C, it becomes readily inactivated. Or D, both B and C. Ayan po. Basically po, B, C, and D, they mean the same thing. African swine fever, pag naging less resistant sila, magiging mas madali silang ma-inactivate. So answer po dito is letter A. So the presence of serum or the presence of blood enhances yung survival ng ating African swine fever. So normally kapag wala pong serum na present, African swine fever may be inactivated by pH less than 3.9 or pH more than 11.5. However, kapag meron na po tayong serum, the resistance of the virus increases. So imbis na 11.5, kailangan mas maging alkaline yung gagamiting pH sa kanya, 13.4. This also increases yung time of survival nila. So instead of several weeks kapag mayroong blood or serum, this may increase yung survival rate for a few months, for a few or to a few years. Important yung blood sa kanilang survival or serum. Number 44. So which of the following does not justify the use of antibiotics in cases of viral infection? So which of the following does not justify the use of antibiotics in cases of viral infection? So letter A, bacteria enhances virion stability. B, bacteria promotes infection of eukaryotic cells. Letter C, both A and B, or D, none of the above. Ayan. Answer po dito is letter D. So we all know po, viruses, they are not susceptible to antibiotics. However, bacteria, they promote viral fitness. Hindi naman nila ini-increase yung viral replication pero yung viral fitness. So first and foremost, pinapahina nila yung host defenses if they are present. And they can invade yung tissues natin, making them more susceptible to viral infection. So we administer antibiotics din to prevent bacterial superinfection. Ayan. So the presence of bacteria during viral infections may also increase yung recovery time and yung disease severity na present doon sa animal. Kaya nagbibigay na tayo agad regardless kung meron na or wala pa. They are also used for prophylaxis na. And last question po tayo. Which antibiotic also has antiviral properties? So which antibiotic also has antiviral properties? Is it A, doxycycline, B, cefovecin, C, rifampin, or D, trimethoprim sulfa? Ayun. Answer po is letter C, rifampin or rifampicin. Depende po sa reference na babasahin natin. So rifampicin, this has been used against pox viruses to inhibit yung kanilang viral assembly. Okay po, how did everyone do? May naka-perfect po ba? That ends my Q&A for today po. More to come sa mga susunod na araw. Ay,
Thank you very much, Doc. Thank you, thank you. Okay, so okay na. Parang gandang warm up 'yon, no? So, we will have a break. I will just end this meeting para lang ma-record yung ginawa ninyong Q&A. And then babalik po tayo, the same meeting, and I will be posting something that you will be scanning para ma-register kayo doon sa para ma-record natin yung mga answer ninyo dito naman sa aking interactive quiz. Okay? Okay po ba? So let's have a break, mga 10 minutes, and then we'll go back kasi i-flash ko yung parang login para makasali kayo doon sa game and then makapag-answer kayo in your phone, no? Or hindi dito sa chat, masasagot nyo doon sa inyong device. Okay? So I'll see you again in 10 minutes.